Britain's health regulator has this week approved Pfizer's COVID jab for children aged 6 months to 4 years, following a clinical trial that involved just over 4,500 participants. The approved jab is specifically tailored to this age group and will give a lower dose of the jab than that used in children aged 6 to 11 years. However, whether the vaccine will actually be used in infants will depend on the approval of the JCVI. To discuss this, I'm joined by Dr. Bharat Pankhania, Senior Clinical Lecturer at the University of Exeter Medical School. I'm off to Exeter after the show, actually. Thank you very much for joining me today, Dr. Pankhania. Do you welcome this announcement?
Welcome. Well, it's interesting. We always have to keep an open mind. I look forward with anticipation to see what the deliberations of the Joint Committee on Vaccines and Immunization will be. This is interesting, and we do not know all the answers. Of note are that in some countries, we've had very high mortality in very young children, like Brazil. In developed, well-nourished countries like Western nations, United Kingdom, we don't know. We don't know what the marginal benefits may or may not be. The jury is out. We really need to know more, and we look forward to learning more about this.
Okay. Do you think that the 4,500 sample is big enough as a size to be sure of the safety of the jab in infants? And what would you say to parents who are concerned about the safety of giving their infant children the COVID jab?
So on that matter, it has gone through its own regulatory and scrutiny processes. And we know that apart from local side effects limited, we have not picked up any untoward side effects further to that immunization. That much we know. And of course, when you start immunizing other people, which is already going on in Brazil, Venezuela, Emirates, China, Hong Kong, we will pick up more and more data every day. So that number of people in the trial, and furthermore, the number of people already being immunized on a daily basis will add to our knowledge. At this point in time, we haven't picked up anything which tells us there are untoward events happening.
Okay. And what would you say to people who say that children very seldomly get seriously ill from COVID, and in fact the fatality rates from the jab are slightly higher than fatality rates from COVID itself in infants?
So let me correct this. So I agree with you that the illness, the fatality rates are very low in the younger age group. However, in children, babies, young children who have got underlying health conditions, there is definitely a benefit of immunizing. There is, we have not picked up any disbenefits, i.e., the vaccine caused my child harm. We haven't picked that up at all. So I really must sort of clear that, which is there are no harm coming from immunizing the child. If you ask me, Dr. Pankhania, what's your opinion? What would you do? I would go along the following lines, which is, if my child has got any underlying other conditions, either genetic or neurological or some other condition that they're born with, I would want to protect them, because the evidence shows very clearly that they become really ill were they to get infected. The other bit is a public health measure, which is, does this also reduce transmission to adults and other vulnerable people in the community? We think so, but we're not 100% sure.